Have you ever wondered if there's a hidden key to alleviating your chronic pain that traditional medicine hasn't revealed? Join us today as Dr. Mitch takes us on a journey with one of his patients. It was really more than a story, it was a medical misadventure that he took.
Greetings, this is Dr. Mitch. I got up this morning and decided I'd talk about fibromyalgia today. I'm going to tell you a story about a patient of mine. It's more than a story, it's about a medical misadventure that he took. And misadventure was over a 10-year period of his life. And it could have been from, but with that said, I was invited to participate in a fibromyalgia support group meeting one afternoon. And I showed up with my little presentation kit and I had 30 minutes. And there were about 15 people at the group meeting, 14 women and one man. So I gave about a 15, 20-minute presentation on the Bowen therapy, the Bowen technique, and explained what it was and how he did it and what it did. And then I asked for a volunteer so I could demonstrate a little bit of the procedure. Now, I didn't have a massage table that day. I had a plan of just demonstrating on one of the members sitting in a chair facing the back of the chair. So I had access to their back with my thumbs and fingers to do the moves and the procedures. And the man volunteered. He said, I want to do it. Come on up. So he came to the front of the room and sat in the chair. And he told me that he had neck pain originally, had neck pain and about a 20-year history of peripheral neuropathy in his feet and legs. When his neck started to bother him, his family doctor referred him to neurology because of the neuropathy that was in the if there's his family doctor figured there might be a connection between the neck and the feet. So that was good thinking. He went to the neurologist. The neurologist didn't know what to do. So he sent him to Wake Forest University Medical Center, the head neurologist there. And he had more tests and more x-rays and MRI. And the neurologist, well, I think you've got fibromyalgia. And by this time, his back was bothering him also. So he had neck pain, back pain, and peripheral neuropathy in his feet. And so the neurologist put him on Neurontin and pain medication if needed, and muscle relaxers if needed, and anti-inflammatory medication. So he went about his business for a number of years. Wasn't getting any better. Came to the fibromyalgia support group, hoping that he'd find something. And so I commenced to work on him, and I did the lower back. I rolled the muscles in the lower back like should. And then I went to the upper back and I rolled the muscles in the upper back like I should. And I backed off because there's rest periods between the groups of moves in Bowen therapy. And when I backed off and let him rest and process for a minute, he said, "Hey, that I can feel a bunch of heat coming out of my lower back." And I said, "That's not too unusual. That is energy that's been trapped and is being released out of the compartment that's held in, and you can feel it. And sometimes it's different sensations, but most of the time it's like a heating pad is on the skin, but there's no heating pad." And so I went back and I did some moves on the neck, and I backed off for a couple of minutes so that he could process. And he said, "Hey," he says, "I'm feeling tingling down in my feet and legs." Oh, huh, that's really neat. And so he's all smiles and laughs. And I finished up the procedures I demonstrated on him for. And it took me about 5 minutes. He stood up and he said, "Wow." He said, my neck doesn't hurt. My back doesn't hurt. I can feel my socks with my toes. I got feeling on my feet. I don't believe it." She says, "I want to make an appointment and have a full treatment." So he came to my office a week later for a full treatment on the treatment table. And he really didn't need it. He was fine. That 5 minute session at the group meeting fixed him. And then he laid the story on me about his medical misadventure for 10 years. So had he, when he took the Neurontin and the it was Tylenol with codeine, that wasn't strong enough, so they put him on OxyContin. And he found that if he mixed the OxyContin with alcohol, he'd get a better buzz. And so he was living on OxyContin and alcohol for a few years, lost his job, almost lost his wife and his house and his livelihood and his self-esteem and his self-worth. And he was down in the dumps. And he had gone through recovery and rehab, and he was off of the pain medication when I saw him. And he was taking non-steroidal anti-inflammatories by the handful to keep the pain subsided. And yeah, I fixed him in 5 minutes. Now, I don't think he had fibromyalgia. I see a lot of people with fibromyalgia, and I think there's a couple of different varieties or grades of fibromyalgia. There's a low grade and there's a high grade, if is what I call it, that, with a mild dose and a severe dose of fibromyalgia. A lot of people are mislabeled like he was. He only had pain in two places, the neck and the back, but his doctor, the doctors know everything. The doctor says that he has fibromyalgia, so he believes he's got fibromyalgia. You become what you think about. You believe something long enough and you become that something. That's a given. I've been there, done that. And so he believed that he had fibromyalgia. There's a lot of people that believe they have fibromyalgia. They just have pain in a three or four, five to six different places because over the time you favor pain in one place, some pain will come up in another place because of the compensation, because the other tissues tighten up. You got to remember that the body is like a chain link, a series of links linked together from the neck, well, there's sphenoid bone all the way down to the coccyx and down to the feet. And those links, if you take any one of the links and twist it, it's going to affect the link below. Then the link below that, and the link below that, and the link over here, and the link over there. They're all intertwined in the internet. It's called the fascia. And when the fascia gets tight, and that's like a secondary trigger point, it's like an accident waiting to happen. You've got a little tight band of tissue that's not supposed to be tight. It's supposed to be pliable and flexible, and it's not. And then you lift and twist and take something out of the trunk of the car, and then it trips the switch. Now you got an active trigger point, and you got pain in the local area or wherever that trigger point refers to. Usually, a trigger point for a trigger point in the neck will refer pain down into the shoulder or in the chest area. or a trigger point below the knee will refer pain down into the foot. And so the active trigger points cause the pain. Inactive trigger points are just little tightened areas from compensation that are waiting to happen. And so that's the usual process. So true fibromyalgia people seem to hurt just about everywhere you touch them. And as a matter of fact, when I do my therapy, if somebody has fibromyalgia and they get massages and their massages are comfortable and tolerable and feel good, I will do my therapy. If the massage is uncomfortable and painful and noxious, I won't do the therapy because the therapy, as gentle as it is, and all I'm doing is rolling the muscle like this, like plucking a guitar string like that in various locations. That's all I'm doing over trigger points, over meridian points, which are energy centers. And that's enough to stir them up. They lay awake cussing me all night long because I made them worse, and I'm not sure I understand why, but I do. So I treat people very gingerly the first session to test the water and try it out, see how they respond and how they feel. And if they feel good after a little bit, then the next session I do more. So that's I've divided the people into a couple of different groups. The people that can't tolerate body work, they need something else, stretching, movement, other modalities that I know new. And then there's the patients that are mislabeled, and with they don't have fibromyalgia, but they think they do. They will respond wonderfully to the treatment that I do. And so, this is just an example of somebody that got run around into the medical system. I think he went to a few other neurologists between the two I told you about, because it was like a 10-year period, and he is focused on his pain that whole 10 years, and when he was drinking and drugging to avoid it, and so that pain that he had in those two places, the neck and the lower back, altered his life for 10 years. And that could have been prevented. So the person is one of the purposes of my being here today and telling you about these things is to open your mind to think, hey, yeah, there are other possibilities besides the drugstore and the pharmacies and surgical procedures to mend our problems, to create remedies for our medical mysteries. And the doctors can figure some of the things out, but they can't figure all the things out because there's some missing chapters in the medical journal and in the medical textbooks that I've discovered. I haven't discovered, other people discovered them, but I put them in, there's about four different categories of things that medicine doesn't recognize that are happening on a regular basis, causing signs, symptoms, and disabilities. And some of them were weird and way out and hard to believe. But if you believe me, I don't have any agenda. I'm not selling any products. I'm not selling my services. I give most of my services away. Now I'm retired. Everything out of life I need, I've got. And so all I do is just help people. And so that's my motive. I don't have any hidden agendas or monetary gain to get from doing these videos. I just want to see the people get the right treatment, the fair shake. But you got to open your mind to the fact that there are other possibilities available. It might work. There's a saying, like my friend Raymond Grace. He's an energy workers. He's a dowser. And Raymond says, if you don't try it, you don't know if it's going to work or not. So why don't you try it? And so you don't know if this Bowen therapy stuff is going to work or not. but just try it. A lady came into maybe yesterday with a swollen, painful knee, bone on bone arthritis, and she had pain in her neck, and she had pain in her hip, and she had pain in her knee. And she got up to the table, and I wasn't partial one way or the other, but I didn't think I was going to help her. Let's put it that way. Whether that I would be of value to her, but I was going to do the procedure anyway and see how she responded. And as she got off the table, and she was a little spaced out, because she was just so relaxed, but the neck and the shoulder pain was all gone, and the knee felt wonderful, and she's posture is all realigned, and she's got smiles, and she grabs her husband's arm and she says, "Let's go, honey," and she's coming back next week for another session. So we just try it and see if it works or not, and it might work and it might not work, but it's not going to hurt. Parts of my program that I will tell you about when you come for a session, if you come for a session, that it will tell about some of the side effects of it. Because there are some discomforts as a result of the treatment on occasion, not as a rule. And so it's a non-invasive. It's done with clothes on. It's non-painful to do, but once in a while it's uncomfortable afterwards. But most of the time, it creates release of tension and relaxation and a balancing of the nervous system. And the nervous system gets out of the all strung out and all the chaos and all the confusion, and it settles it down, and it puts people into the parasympathetic phase, which is your rest and digest and healing mode. That's the mode where we're healed. When we're sleeping, we're resting and digesting and healing. And that's where you want to be most of the time, when you're not reacting to something that you've got to react to. But most of us we're reacting all day long, and that stress is putting out adrenaline, and that adrenaline is suppressing histamine. We've got our own natural antihistamine, and that suppresses the healing process, because inflammation, release of histamines, and inflammation is the first stage of healing. So we want a little bit of rest and digest, so we can suppress the adrenaline. So the adrenaline is suppressing the histamine. So that's all for today. And if you like this video, be sure to hit the thumbs up when you like it, and share it with another person, because somebody else might benefit from it that you love. And subscribe to my channel. I'm going to have some more videos coming up, and I'm going to tell it like it is, and hope to keep people from unnecessary surgical and medical events and medical misadventures. Thanks.
If you found this video helpful, please give it a thumbs up and subscribe to I Am Dr. Mitch YouTube channel for more tips on staying healthy and active. Dr. Mitch would love to hear your thoughts or questions. Leave it in the comments below, or visit bowenforlife.com to connect directly. Your feedback and questions help shape future videos. So don't be shy.